Okay. And are there any long-term or short-term effects that gestational diabetes can have on you or your baby?
Yeah, so in the short term, there are those risks like you'll read about online, or your doctor's probably telling you right when you get diagnosed, okay, this is what we're watching out for. The hallmark of gestational diabetes is high sugar in mom, then leads to the baby kind of taking that sugar and turning it into little cushy body fat. So the risk being that baby's going to grow too large. And if we're trying to have a natural birth, then a large baby could possibly mean, baby getting stuck in the birth canal, increased risk of tearing or bleeding for mom, or risk of having to have a C-section, either planned or emergency, because of the size of the baby. Also, once the baby is born, there could be a risk for immediate like hypoglycemia or low blood sugar for the baby. So that's why it's important, even size aside, to have well controlled blood sugars during the pregnancy. So that's kind of like the right now risks and complications. And there are long term risks that we're, still researching and trying to figure out exactly what that looks like. But we do know that mom could be at a higher risk for prediabetes or type 2 diabetes in their future, and as well as the baby, right? They're kind of getting a little bit of that fetal programming in utero that could predispose them to diabetes in their lifetime too.
Okay. And I know this is kind of backtracking, probably not necessarily in order, but what is the test for those that don't know? And then like, do they test you around that 26-week area, I'm guessing?
Yeah, unless you're showing certain risk factors, they might want to test you earlier. Like, let's say you have polycystic ovarian syndrome, they may want to do it a little earlier. But typically, around that 26 to 28-week mark, whenever you can get in your OB's office, here in the United States, we do what's called a two-step method. So you'll go in for phase one, right? Step one, you'll drink a 50-gram glucose solution called the glucola. I'm sure lots of your moms are familiar with it. It comes in all sorts of flavors, and you'll drink that drink, and an hour later they'll check your blood. So based on that value, you'll either, it might be elevated. So if that value is elevated, then you'll go on to do a 3-hour glucose test where you'll drink 100 grams, so double the amount of that glucola, and they'll check your blood sugar then fasting, 1 hour, 2 hour, and 3 hour. And on that test, if we see that two of those values are elevated above the targets, then that's indicative of a positive gestational diabetes diagnosis.
So they might test you like a little bit earlier if you have like PCOS. Are there any other like signs or symptoms that you could be experiencing that are signs that you might have it?
People ask me that all the time. Like, they'll get the diagnosis and they'll reflect back and they'll say, well, yeah, I was really thirsty and going to the bathroom a lot. And they hear that those are signs of diabetes. Like they have a relative who, had experienced that too. But I just tell them that's likely just pregnancy. You're super thirsty and pee all the time in pregnancy. So that's maybe not the best sign. But that's why I say like those preconception or first trimester screenings of your blood sugar, getting like a hemoglobin A1C, which is a measure of your average blood sugar, getting that early on, I think would be the best way to kind of like get one step ahead of the process.